Hello, everybody. Here is Alexandre Martins speaking. I am a professor of bioethics at Marquette University in the theology department in College of Nursing. And I am here to talk to you very quickly about some ethical concerns regarding the coronavirus outbreak in the disease that generated called COVID-19. And then I want to talk to you some very quickly element, just an introduction relate to just four topics: the U.S. health system, the outbreak and limited resources, decision making in the situation of scarcity, some ethical principles, and the situation of care beyond any kind of need for ethical support. So when you talk about any situation here in the United States, you need to consider the U.S. health system. The health system here is not actually one single health system, but a plurality of systems. So it's U.S. health systems in plural. They're very complex and they are not necessarily connected to one another. So a system here in Milwaukee and Wisconsin is not connected in a system in Illinois. They are private companies, and that creates a lot of issues for the organization of the care we need to provide, and some limitations, because we have to consider the United States have about 25 million people who do not have insurance, plus another approximately 11 million people that are immigrants, like undocumented immigrants, who also do not have insurance. So that creates a problem in terms of justice, that the ethical principle very important of accessibility. Now the tests could be accessed and you'll be paid by the government. We have free access, but then you have questions about the accessibility to the treatment, because that could be very expensive, even for those who have insurance. So that creates a problem for the most vulnerable and the most socioeconomic vulnerable, because they can get sick and not have access to the treatment. So the second element is about the viability of resources. We probably have seen now many people talk, oh, if you get a huge outbreak of people with COVID-19, you don't have enough ICU beds for them, and what can you do? You have to try to flirt the curve to prevent from that. But maybe now it's too late to do that. And at some point, we'll have a huge outbreak of people with COVID-19 who need inpatient care, who need special ICU care. So how we can make decisions to address that? That go to the third point, the decision making in a situation of scarcity. Here in the United States, health professionals has not been trained in to deal with scarcity of resources. I am a healthcare professional, and I was trained in Brazil, and there actually we had situation to do with limited resources and more people than the resources you need for them. But that situation not easy. It's very stressful. It creates a lot of drama and a lot of conflicts. And the first conflict you have here is when we are training to provide the best care for a patient, so the patient-centered care. But then we have to move from that perspective to a perspective of public health care center, to think what's the better for the community, for the entire population, and see how you can allocate our resources that better serve to our population. And that is very complex, because you can get the situation when you have multiple people need ICU, but I just have one ICU. Who takes priority? How to make decisions about that? That is not easy. You need to get prepared to do a very important element of triage. And that triage have to respect human elements and principles, but have to consider clinical and therapeutic prognostics. So we need to care of those people who have more chance of success, therapeutically speaking, not based in social and any other aspect, but therapeutic speaking. So the provider have to make the decision considering the human dignity, but also the therapeutic chance of success with the patient who have COVID, and also specifically clinical situation, and trying to be objective of this when you do to the decision-making process. Then we put the principles. We have to consider the principle of human dignity, the equity and equality on the distribution of resources. Be transparent, talk to people, be clear, talk to family of patients, be clear about what they could expect and what the resources you have. We doing the best, but we can do miracles. And proportionality, that go in terms of the therapeutic success. The issues we put, the resources you put in your person must be proportional to the benefits that can create and the risks that it can take. We cannot put too much resources in one person. A situation like that, you don't have a kind of a relatable or rational benefit for this patient. And then being solidarity, that leads to my conclusion, because when you say care beyond the technical support, even those people who unfortunately can't provide the care we want because it's scarce, we always can be with them. We can support them, we can support the family, and then palliative care became very important. And also even chaplaincy, counseling, spirituality, being together with those people, even if they are a terminal patient, help them to have a dignified death we support. We can, the limit of resources can limit our action to provide that therapeutic or healing care, but we always can provide the best care it's possible. So for our patients, intent to also help them to die and die well. So that's what I have to introduce you. So to that ethical concern that will be debate in the next few days. So thank you for watching the video and stay healthy.